Acting Chief Medical Officer Shawn Charles in the Ministry of Health says the ministry has been working steadily on contact tracing since the announcement of 3 individuals testing positive for COVID-19 on arrival at Trinidad and Tobago from Grenada. The second results of the 3 Trinidadians are still pending. Dr. Charles says the Ministry of Health took a broad approach towards the people that were contacted, regardless of the limited contact they had with the individuals during their stay on island. The CMO said so far, an average of 152 people has been tested and the results received are negative.
In excess of about 152 samples for PCR testing. The first batch of 50 was processed yesterday and they were all negative. As I say, our objective was to try and find anyone possibly who might have been exposed to the individual and test them. Now, so far we have not encountered, we have not found anyone who was sick or had a history of being sick, all right, or displaying any suggestive symptoms of disease. We are doing all of this in response to the reports that we received that these individuals were positive. So like I say, it's just being abundantly cautious.
That the individuals were directly involved with, and as such, precautionary measures were taken. Dr. Charles says that additional testing will depend on the results received.
Well, I mean, businesses, they will take the precautions that they deem necessary. We cast a very broad net. So we reached out to all of the, based on the activities of the individuals, we looked at places where they would have had some degree of exposure to. And we have reached out to these different places and we have conducted testing. We tested these individuals and we are awaiting the results.
From the pending COVID-19 tests done by the Ministry of Health. For GBN News, I am Rina Pear reporting.
That is the aim of contact tracing in itself, is trying to reach everyone, trying to rule out whether they are infected or not, and as such a danger to other persons. So once that is exhausted, then there will not be a need for further testing.